I'm Dr David Geddes. I'm the Primary Care Commissioning Lead for NHS England. My main role is to be able to take a lead role within the NHS England, the new organisation, to be able to create, I suppose, the best value for primary care. So it's all about trying to make sure that primary care takes a real lead role in moving forward with the new NHS. Moving forward for the NHS, we need to maximise opportunities for networking both within a discipline but also outside it. So it's really important for events like the NOC to be able to bring together for cross-fertilisation of ideas, to be able to understand the barriers to sometimes implementing good clinical pathways, and also to be able to create seeds of thought and innovation as to how we can take that forward. So it's a really good opportunity for the profession to share those ideas. It's a great opportunity for others like NHS England to come along and seek views so we can actually hear from the profession and from a large number of the profession the issues that are burning, which are critical for us to address if we're going to be able to make this move forward. We are facing now a very significant time bomb in the NHS in terms of how we are going to address some of the significant changes in health or the demands for health. So yes, an ageing population brings with it significant challenges in terms of providing healthcare. So it's really important that in moving forward we get clinicians with knowledge of what patients' needs are to be able to articulate and work together to describe care pathways. I think it's a real good opportunity to talk at the NOC conference about the National Primary Care Strategic Framework. That'll have been described over the summer and the early autumn and takes a very strategic overview from NHS England's perspective of what we feel that patients should be getting from primary care. So we want to be able to describe how primary care will work together with secondary care colleagues to make the best use of NHS resources and to create a high quality environment for patient care. I think the take-home message for many of the attendees at the NOC will be we want to make sure that clinical leadership is not all just the province of GPs within clinical commissioning groups. It's really important we make sure that the local professional networks, and in particular in this situation, the local professional network for eye health, is properly represented by people who have clear understanding of what the issues are for patients. So the message is, let's get involved from a clinical perspective in commissioning and driving that forward.